Hello and welcome to another episode of Saddlers TV. We're here in the 1888 Lounge at the Banksy Stadium, and I've once again got two very special guests alongside me. Head of Medical Department and Sports Science, John Whitney, and Assistant Physiotherapist, Hannah Price. Good to have you with us, folks. Lots to get through. If I could start with just a bit of background on both of you really. John, if we come to you first, how did you get into this very prestigious role at the club?
It's quite a long story, but we'll keep it really short. I did some scouting for Colin Lee. I'd just retired from football with a knee injury, and Colin Lee got in touch with John Beck. He said, "Is there anybody up north who could watch a couple of games?" Put my name forward. I was out of work at the time, just had a knee operation, and I did a couple of scouting reports, which was a first for me. And then, luckily, or unluckily as some might see it, there was a position came up, physio. Kevin left to go to New Zealand and they needed a physio. I came in for the interview, not expecting to get it. Came in quite informal, had a chat with the old Dr. Ralph Rogers, the chairman, and Colin Lee, and talked myself into it. And I'm still here now, 12, 13 years later.
Hannah, what about yourself? How did you get into it?
So I've always been involved in sport from when I was really young. I was a gymnast for about 10 years, and during that time I sustained a lot of injuries, so that's what first got me interested in sport, injury prevention and rehabilitation. So from there I went on to study sports therapy at the University of Hertfordshire for 4 years, and then I was fortunate to get an internship at Walsall Football Club and spent a whole season with the first team, which I gained invaluable experience. So now I'm assistant.
Here I am.
She stuck with me.
John, you obviously enjoyed a career as a professional footballer. Was there a point that you decided, okay, you've got to start looking at what you're going to do after football, or did you just fall into the job as you were doing?
No, I turned professional late. I was 22. I did an apprenticeship at Wigan, got released, spent a couple of years non-league with Winsford United. We had a really successful season. A few of us turned pro, and I turned pro with Huddersfield Town. After two months of turning pro, my dream had come true. I snapped my cruciate ligament in my right knee. Never had an injury before, and my treatment wasn't great, to say the least. So I started to have to more or less treat myself, and that's when I started getting into the treatment side and everything else. So it started from then. So I turned it into a positive, and then 25 I started to do the FA diploma in the treatment and management of injuries, and from then I kept getting some qualifications. I went back and did some AS levels, and when I was 30 I applied for the chartered course, and that coincided with me retiring. I did the part-time course at Salford.
How big's that, the educational side of things? And you've obviously came for education as well, which you've always been, bettering yourself, getting more diplomas and certificates. How crucial is that in becoming a physiotherapist?
I think personally for me, experience was the main thing. I think you learn all the underlying knowledge at university, but then actually applying it to the real world is what you really need. So
a lot of people argue, don't they, about which one's more important, and we talk about it a lot, but I think it's 50-50. I think you can't have one, you have to have both. So I always say to interns, you've got to get your academic support as your foundation, but then you have to get your hands-on experience. You have to put it into the real world. Anyone could read a book and apply that and pass an exam, but it's your communication skills as a therapist and how you relate to other athletes and people. That's the biggest thing for me. You have to learn, make mistakes, be in an environment where you're challenged every day, make mistakes, hopefully not a really bad one, and just learn from it, reflect, and just move on and better yourself each week, each day. And then that's how you become a better professional, I think. And
Hannah, you spent time with the academy as well. What's that like, treating some of the younger players amongst us? As challenging as it is the seniors?
It is slightly different. Like in terms of injury prevention and how I treat the injuries, it's exactly the same as I would with the first team. But I think the pathologies of injuries is a little bit different because of the age group. So there's a difference in what injuries they get. But for my job, it wasn't much different to how I approach the first team.
Do you think that's key? Do you think that's key to what we do at the club? That message is the same all the way through, regardless if it's a 9-year-old or a 29-year-old. We're giving that same information to players.
Definitely. So continuity from the under-9s all the way through to the first team pros. I think that's really important.
And John, to have Hannah alongside you, how invaluable? 26 senior players to deal with, some of the younger pros as well. How valuable is she to what you do?
It's great. It enables me to spend time on injury prevention strategies rather than hands-on treatments. That's what takes up a lot of my time. For the first 3 months, it was just me. So it works out really great because we had no injuries for 3 months, so it worked out really well. So there's pros and cons to it, but it's great to be able to manage the loading of the players because you can do the preps, do all the gym work, monitor the training, the length, the duration, the recovery strategies, the nutrition. It's good, it's great, but sometimes I need to go off site. Like today I've been at the pool. Right. If I didn't have some help, some cover, I couldn't then take the players to the pool to do a hydro session. So it enables me to have more strings to my bow, and Hannah's a great addition for the gym work as well. She can supervise while I'm outside doing some field work. So you need an assistant really. It's very difficult with that one.
So first thing in the morning you come in, how do you devise what your roles are in a day? Talk us through a typical day at the training ground.
I'll talk you quickly. It starts as soon as the previous day's finished. We're all ready. Then I set up the gym. We usually clean it, hoover it. Hannah will probably get the mop out and mop round. So we'll make sure, I always want a clean, tidy gym. So then we'll put it up on boards what we're going to do the next day. And I always set my circuit up the day before because it's so busy the next morning. That's the busiest time I find. So we'll plan it, we'll work out which players we've got, and then we'll work out which stage of their rehab they're at, whether they can join in a little bit with the squad or whether they've got to do individual purpose just for them, depending on the rehab they're at. And then we'll work around that and plan our day. So it starts around about 7 in the morning when I get in, and then Hannah will come in around 8 to 8:30, and then I'll talk Hannah through what she's going to do as her role, and then we'll just come together with the staff, work out how many are going to train, and then we'll plan it through the day from then on.
How much have you learnt from this man sitting next to you, Hannah, since you've been at the club?
Loads. Yeah, like I say, like going from university to working in the sporting environment is really important, but yeah, I've learnt so much. So I've basically I can now apply the knowledge that I've learnt at uni to real life situations, which is what I needed, and even learning life skills and managing my time and everything really. Yeah.
Looking at pre-season, which you already mentioned it, for those first 3 months we were okay. Very few people in the treatment room. Picked up a few injuries these last few weeks, but if you go back to last season, I think we're up to like 9 injuries in the first few weeks. Did you do anything differently this time around pre-season, or was it just a coincidental one of those things where you had a succession of players picking up injuries? Yeah,
I think for me as a therapist, I see myself as an injury prevention therapist, which is what I try and push over to Hannah. We should be putting most of our time into injury prevention. What you don't want is too many intrinsic soft tissue injuries. That means that I think it can be prevented in some way. When it's innocuous, like last year when you think we went to Exeter, which the surface wasn't great where we trained at Exeter, so we lost Ben Perkins with an ankle, which is innocuous. There's nothing he could have done prehab, nutrition wise, anything to stop that happening. Cookie was really unfortunate, landed on a player's foot, rolled his ankle, fractured it. Sam was unfortunate on holiday to have an injury on holiday, which is probably only happened once in 13 years. So things just happen. You're not overly concerned. Even the couple of weeks ago when we lost Neil Etheridge, Sam and Tails in one hit.
Bad game that was.
None of them were intrinsic. It was Sam got put off balance, rolled his ankle. Tails got hit with a hematoma in his hamstring. Neil got hit by Paul Down and ripped his knee open. So I can go to bed at night and relax with that. But if I come off and there's been 2 hamstrings, a thigh, that's when I start to think, have we made mistakes? Have we trained for too long? Is the player making mistakes in his preparation, his recovery? So that's where it becomes difficult, where you get a lot of soft tissue injuries. Luckily, we haven't had that for quite a few years now.
How much of it is down to what a player can do? The conditioning. You look at Adam Chambers as an example, mid-30s, but he looks as fit as an 18-year-old still, getting up and down the pitch. How much of it is down to the player and conditioning themselves?
Yeah, I'll answer the first bit and then I'll pass it over to H because I talk too much. So I always say to them, the 3 hours we get in contact with them isn't the most important time. The important time is your 21 hours by themselves, how much sleep you get. We're always trying to drip feed them information on sports science, your technical, how you can improve technically, physically, tactically. There's so much to take in and there's so many components to build on. You have to use your whole day as an elite athlete. So when you come away from us, they have to plan what they're going to eat, what snacks are they going to have mid-afternoon, what they're going to have for dinner, how much sleep they're going to get. Plan your breakfast, plan your training based on what time of the week it is. So it's huge. The players that do that best are the players that play more minutes, earn more money and give themselves a chance to fulfil their potential, because what they don't want is these unnecessary injuries. So Hannah can probably speak a little bit. So use Adam as an example. What would his daily routine quickly be for Adam from what you see him in the morning?
So having a decent breakfast, so loaded up on carbs, getting lots of fluids in. In the morning he'll do all of his like myofascial release stuff. He always joins in with the prehab circuits, which we set up for them. But yeah, he's one of the players that manages himself really, really well, and he does all the important things right through the day, all the way through to the evening.
We'll come back to this discussion in a few minutes. We're going to take a short break here on Saddlers TV. Join us ever so shortly for the second half of the programme. Welcome back to Saddlers TV. John Whitney and Hannah Price join me for today's show. Lots to get through. It's mad how quick that first half went. John, I've got to ask you about something that I don't think many supporters will know about, but the fast zone. So this is something I've seen around the training ground, I've heard players talk about, I've heard yourself talk about, but just tell us what it is and where you coined the term.
Yeah, it's a training concept I've been developing for, well, I suppose for the last 10 years now. It's based upon... It was based on, we've had a lot of players over the years coming to us from top clubs, from Man United, Manchester City, Man U, Liverpool, and even though they come from top clubs with all the finance that's open to them and the staffing structures and everything else, they still come to me with so many imbalances, and it takes me quite a long time then to try and correct that. And the older you are, the harder it is to correct. So I just wanted to work on trying to prevent imbalances at a young age, because it's much easier than trying to correct one at a later time in their career or as an academy, as a scholar. So we started to devise some movement principles based on the movement patterns of football. So it's based on biomechanics, and it's a body position. The fast zone, FAST stands for functional agility, strength, speed, specific training for football. You can apply it to any sport, but I'm applying it to football. So we look at the movement patterns of football. It improves you technically because your body position's better. So you've got a lower base of support. It improves your speed, so it's also performance enhancing, and it also is specific to what we do. So we take it from the gym at a conscious level at slow paces, and then we progress it through daily routine habitual patterns onto the field to make it subconscious at high speed. So it's something you've got to start early pre-season, which is why, in a way, we've done so well as well. It's a component because the same players have been with us for a couple of years now, so we don't have to spend too much time teaching the philosophy and those movement patterns and the biomechanics and the little sayings like break small and grow tall. It's all about not planting a foot, staying within your shoulder width, keeping triple flexion at the hips, the knees, the ankles. Not to go too scientific, and that helps us then to react to any movement pattern, and it also prevents injury because we're training the body to withstand the forces in all ranges, depending on what the extrinsic effect is, whether it's an opponent or whether it's just a single leg landing. We're trying to teach the players to prevent injury but also increase performance, and we've applied that right through the club now.
It was interesting what you're saying about the fact that we've had the same bunch of players, so you don't have to drill it into them as much. Does that mean that you notice the difference with the players that do come in and join? Neil Etheridge, Jason Dimitri, or any of the players that have joined in the past few years?
A huge difference. And you probably, because you see in the gym, because I get Anna sometimes when a lad comes in, I say, can you have a look at him? Just have a look to see what his stabilisation's like at single leg on a trampette while he's trying to move a resistance band at the same time with his head up without looking down at his feet. And what are some of the things I'm testing you now? What are some of the things that, as somebody who hasn't done the fast zone philosophy the last 6 months, what do you see?
They often get a drift of the knees, so we call it valgus. So that can cause an ACL injury if they don't correct that. They also have a bent back, so they don't have a neutral spine. The head's down. I think they're the main.
Is it quite obvious to the trained eye that you can see the difference?
You see a lot of shaking. And keep it in layman's terms, because the neuromuscular control hasn't been trained enough in all them ranges, because football's a single leg sport. We do a lot of our stuff on a single leg, so we have to work at that daily 300-400 repetitions every day, and eventually it becomes habitual when they play. And we've won the Fair Play Award for 2 years because we don't dive in, we don't step outside our zone. It's an interception game now, the modern game. We teach our players to be ready to intercept 5-10 yard sprints.
Heart rate monitors, another thing I want to come on to. You see most teams now with players at training, sometimes in games, wearing heart rate monitors. What do you get from that? What information can you get that then determines what you do following the results from that?
Most clubs now, all Premiership, Championship, half of the League One now, you'll see them with the little bump in the back of the shirt. They're wearing GPS units now. GPS are being trapped obviously by satellites, and they tell you your distance covered, your speed of distance, how quickly you decelerate, accelerate, your vertical movements, how hard you hit the ground. So it's all about this loading to see how quickly a player fatigues. Right. We had them pre-seasons to get a fingerprint of each player. So we know in a game how much the average distance for our wing backs, our centre halves, how many metres, high intensity above a certain kilometres per hour. Tom Bradshaw, I know Tom Bradshaw covers over 1,000 metres above 23 kilometres per hour. Right. He covers 11.5 to 12,000 metres total. Breaks over 900 times, takes over 70 high decelerations, which when you look at his hamstrings tells you that we have to strengthen his hamstrings when he's really tired at the end of training, which has helped us. You don't know much about him, do you, really? Don't know much, no. Know everything about him, yeah. And he's a Welsh international as well, so he's not bad. Yeah, and obviously we have heart rates as well, which we look at loading, but you could probably talk a bit about, because the academy use that as well, don't they? Yeah,
so we use it in the academy as well. So it just sees if they've overtrained or undertrained, depending on the day it is. So say before a game, you'd want them to be quite low loading so that they're not at risk of injury on the Saturday for a game, and then the Monday, Tuesday, the loading should be a lot higher. So yeah, we use that right through from the academy all the way through to the first team. So again, that continuity.
And that ties into the fact if we've got a scholar who we know is a high loader, when he comes to us, if he's fortunate enough to get a professional contract, we know what his footprint's like. Yeah. We know what kind of a loader he is.
Already got a picture.
Yeah, we know that if he trains on a Friday hard, like Adam, then he'll struggle on a Saturday. So you've got to just wrap them in cotton wool. Just let him go out and have a small jog, and that's it. Yeah. And then you have your ice baths and get them off home. It's all about it's a results business. We have to get those players ready for the gaffer on a Saturday. That's our job as a sports science department.
Talk us through the procedure then. A player goes down injured here at the Bankses, say Sam Manton a few weeks back, suffers an injury. From the point that he goes down and you have to run on the pitch all dramatically and treat him, to the point that he's back playing again, take us through the steps of rehabilitation that you do typically for an injury of Sam's nature.
Yeah, so for Sam, the best thing to what's great, we video everything. So I always watch the game. Sometimes it's hard when you've got Richard and the gaffer and the fourth official walking in front of you, but try and watch it, because if you can get an idea straight away, you're already getting pictures as you're getting ready to come onto the pitch. And then you come on, then you go through, they call it the SALT app: see, ask, look, test, active, passive, strength. That's what you're taught, but you don't do it in that order. You just get a good idea with experience that he's not moving. It's obviously, from the player's facial expression and everything that it's something quite serious. And obviously with Sam, I could see the swelling straight away through his sock, so his ankle was twice the size. So no need for an assessment there. We're just getting him off. So you're getting him off, and then it's all about removing him from the field of play as safely as you can, assessing him. Then the doc probably assess him, then assess him after the game in more detail, make sure there's nothing that needs any surgical or hospital treatment, and then from that we put Sam on crutches in a air cast boot which protects the injury, and then for 4 to 5 days it's about controlling the swelling, protecting the injury. Then you follow your price: protect, rest, ice, compression, elevate, like we all do. And then after that we take him through the acute phase, subacute from 4 days to 10 days to get the swelling down. Then we go to his early gym rehab, where we do the opposite leg. I try and get them working as quickly as we can, even though the ankle's swollen. We still need to work the rest of the body to stop the detraining, because that's the biggest thing that's going to lengthen his absence. And we're at the stage now, 3 weeks plus, where Sam's running full pace, straight line now. Brilliant. So he's fan, and obviously because he's such a fantastic athlete, it's great to rehab Sam, because you've got to get the reins on him. So another 2 to 3 weeks we take him through from that. He's on the field now. We'll start to move him from side to side, start to do specific drills with the ball, position specific drills. We'll get him up to his maximum speed from his GPS, and then we'll release him back once he's got equal strength left and right. So 2.5, 3 weeks, Sam will be back. Yeah, good news. That's positive stuff. I've got a list of questions for us to get through, but we're running out of time. Hannah, I just want to come to you very briefly about what it's like being a female working at a football club. It's always been a male sport, traditionally at least. Do you feel comfortable? Does it take some getting used to? How have you found it? Yeah, I think, to be fair, fortunately we've got a really, really good bunch of lads.
and I've had no problem at all fitting in, even right from the start, from my internship. I don't know if it would be different if I was in a different club, or but I felt like I fitted in really well. I think sometimes you have to be thick-skinned, you have to be able to laugh at yourself. A bit of banter's good every now and again, but at the same time I believe professionalism is really, really important. And, you know, the staff are amazing, and I think and I hope that the players respect me as you know, just another member of staff. I wouldn't want it to be any different. So
was it something that worried you before you came here? Did it play in your mind?
not at all, no.
Not
Like I've got loads of brothers, so I've grown up with loads of boys, and at uni I shared houses with girls and boys, so I've never had a problem fitting in.
John, I just want to get your thoughts on Eva Quinheiro. Obviously the Chelsea, it was a bit of a debacle, a scandal. How did you see it from a professional's point of view?
Yeah,
Briefly.
As regards to the protocol, she was following things right. The referee calls her on, and it's her job and her duty then to go on for the health and safety of the player. Obviously, there's little things when you look at it retrospectively. She maybe could have come down the sideline a bit, waited a little bit for the player to try and maybe. I always ask the players to ask the player, is he okay? Yeah. So through experience, I always walk as close to kind and ask maybe the captain, can you just ask if he's all right? I think there was a bit of an overreaction from Jose, but with the pressure of the game, I can understand that. Exactly. But I think from Eva's point of view, I don't think there was any major issues she did wrong.
We could go on about this all day. I'm ever sorry to cut us short. Thanks ever so much for coming on, Hannah and John. That's all we've got time for here on Saddlers TV. Join the debate on Twitter at WFC Official and use the hashtag Saddlers TV. Thanks for now.